have you ever seen somebody with varicose veins? They're those swollen, twisted veins, mainly in the legs. They can be unsightly, but for those who have them, they can be painful. Compression socks can sometimes help, but there is a new treatment. Dr. Matthew Smeds is a SLUCare vascular surgeon here to talk about VenaSeal. Good morning, doctor. How are you?
Good. How are you doing?
I'm well, thank you. First of all, what causes varicose veins, and are they more common in some people than others?
Well, there's a lot of causes for varicose veins. Predominantly, it has to do with what you do for a living. If you stand on your feet for long periods of time, particularly on hard floors, surgeons, for example, are at a risk for varicose vein development because we stand on the hard operating room floors, factory workers, these kind of things, hairdressers. So anytime you're standing on your feet for long periods of time, it's also caused by people who are a little bit overweight because you have that pressure pushing down, and it does run in families and occurs more commonly in females. So those are the primary risk factors for development of varicose veins. If you have any of those factors, you might be at risk.
Yeah, we see some people wearing those compression socks. We know that's a common treatment. Are there others?
So we always start with compression stockings for people who have varicose veins. It pretty much helps with symptoms 100% of the time, but they're hard to wear. St. Louis summers, people don't like to be wearing these tight socks. They're hard to put on for people who have arthritis and these kind of things. So we've developed some other treatment strategies, and that involves basically destroying the veins that are affected. The varicose veins themselves are caused because the main superficial vein in the leg is incompetent, and so there's pressure pushing back down on the leg. And so if we get rid of that incompetent segments, then we can treat the varicose veins.
And if people leave them untreated, can they lead to other health issues?
So ultimately, these things are usually just more of a nuisance as far as symptoms go, as far as feeling bad, looking unsightly. They can cause ulcerations of the legs or problems with leg swelling down the line. They can cause discoloration to the limb. They can cause deep form deep clots in the legs, which can be a problem. So getting rid of them if they're symptomatic is an important thing to do.
Are you seeing some success with the VenaSeal treatment, and do most insurances cover this?
So VenaSeal is an interesting concept. So, we talked about destroying these veins in the past. There's a couple of ways we can do this. The one in the old days, which we used predominantly, was to use a laser basically to destroy the vein from the inside. This required a lot of shots along the length of the vein. The VenaSeal is basically a medically adhesive glue, and we use this in the same way to destroy the vein. We basically fill that incompetent vein up with this medical adhesive glue, and it prevents the blood from going backwards in the leg. The benefit of this compared to the old way that we used to do it with the lasers is that it's only a single poke, and so we, just one needle poke on the lower leg to get the catheter into the vein, and then we fill the vein up with that glue, and so it's a lot better tolerated by patients. A lot of insurances cover it. It just kind of depends on what you have, and more insurances are being added each day. So I think that it's a good option. The other option with the laser is also a great option. So there are a lot of things that we can do to treat these things.
Great information, doctor. We appreciate it. And for anybody watching who's more interested in this, you guys host some virtual screenings so you can find out what might be the best treatment for you. If you want to learn more about VenaCare, you can go to SLUCare.edu. We'll also have that on our website, as well as our Fox 2 mobile app. Doctor, thank you so much for joining us.
Thanks for having me.
Time to take a break. We'll be right back at 7:48.